Well, hello, everyone, and welcome to our practicum and internship panel for the MA in Clinical Mental Health Counseling program here at Palo Alto University. My name is Tanya Romero. I am a senior admissions counselor, and I work primarily on recruitment for the master's program. So I may have spoken to quite a few of you at some point or another. But today we're going to be focusing on our practicum and internship requirements in the master's program. Hopefully get some answers for you guys and give you guys some space to ask your questions. So today we're going to be focusing on that primarily, but if you do have any questions about admissions or the program itself, I will be your first point of contact, and I will be dropping my email in the chat throughout the webinar. So if anything ever pops up, feel free to reach out to me, and I'm happy to have a conversation with you guys. But with that being said, this panel would not be possible without our wonderful panelists. We are joined today by some of our great clinical staff as well as our current MA students. So I'll go ahead and let them introduce themselves as well. Let's go ahead and get started with our student panelists. Jordan and Jennifer, do you guys want to introduce yourself first?
Yeah, my name's Jordan, and I actually am in the same cohort as Jennifer, which is pretty cool. I'm in Ohio, so I'm on Eastern Standard Time, so it's 3 o'clock for me right now. I'm currently in internship, and I'm excited to be here and see you all today.
Hi everyone, I'm Jennifer, I also go by Jen, and as Jordan said, we're in the same cohort, so it's really great that we also get to intersect in different areas. I am currently living in the San Francisco Bay Area, Sunnyvale specifically, for those who are familiar. I am originally from Taiwan, grew up in Sweden, came to the US as an adult. And yes, I'm just excited to be here.
Awesome. Thank you both for being here again. Now for our clinical staff, Dr. Herwick and Meg, do you want to introduce yourselves?
Do you want to say hi first, Meg?
You go first.
Oh, okay. Hi, guys. I'm Dr. Herwick. You can call me Diana. I know I've met some of you, so good to see some of you here again. I am the Director of Clinical Training here with PAU. That means I'm kind of responsible for all things practicum and internship related. I teach a lot of the practicum and internship classes and some of the other courses. I am licensed in California as both an MFT and a PCC. Most of my time was spent in Southern California. I am currently on the East Coast, though. I moved over the summer, so I'm working and practicing from the East Coast, but still under my California license. So looking forward to working with y'all at some point, should you go this route. Meg.
Hi, everyone. I'm Meg. I'm the practicum and internship coordinator. I don't know what else to say about myself. I'm also residential. I'm actually on campus right now. So if any of you will be in the residential program or in the area, I would be available to meet with you in person. I think that's about it.
Yeah, thank you so much to both of you guys again for being here. So we're just going to go ahead and jump into some of our most commonly asked questions in regards to the practicum and internship experience. These are preset questions, just that I've seen a lot of inquiring students ask, but we'll also leave some space towards the end of the webinar if you guys have any questions. And if anything pops in your head throughout the webinar, feel free to pop them in the chat, and I'll do my best to keep track of them for our Q&A. But yeah, let's go ahead and get into it. So our first set of questions is for our clinical team, Dr. Herwick and Meg. Firstly, can you explain what exactly is a practicum and internship, and how do they kind of differ from each other?
Yeah. So I know Jordan said she's in Ohio. I'm curious how many people are not in California. I see two hands. I know there's 3 pages, so I don't see you if you're on the other page. Okay, perfect. So there's probably quite a few of you. So I will tell you that practicum and internship, those words are really CACREP words. So in 49 states, they use them a lot. In California doesn't really recognize practicum and internship, but we as a California-based program use those words because we're CACREP accredited. Practicum and internship only differ in that practicum is at least 1 quarter, internship is at least 2 quarters. Practicum is kind of about having your hand held a little bit more. So while you're at a placement, you have a lot fewer hours, you have a lot of training, you're onboarding. probably a lot of shadowing during that practicum time. By the time you're in internship, the expectation is that your caseload has doubled at least, sometimes more than that. That you are working more independently, still under somebody's supervision, but you're not necessarily sitting with somebody in the middle of sessions. You're doing sessions on your own, whether they're individual, couples, families, group, children, or adults, it doesn't matter. You're on your own. You're responsible for paperwork and everything that a licensed clinician would do. You're just doing it kind of under their supervision. So that is the difference, so that you know, especially if you're applying at other programs, because we're a CACREP accredited program, during that field experience, you do 700 total hours. So of those 700, at least 280 have to be direct clinical contact hours, like actually doing therapy. The others are, you know, supervision, training, case notes, staff meetings, research, those kind of things. If you are in California and you are going to be pursuing MFT license, the neat thing is that the bulk of those hours you do count towards your license. That's pretty cool. That's not the case if you're on the CMHC track or if you're in other states, because other licenses don't allow that. But for MFT, you can have a bunch of hours done while you're a student. I think that's kind of the overview. Meg, if I forget something, chime in, please.
I think you about covered it. I guess the only thing I would say is just to reiterate what you've already said. The requirements you're describing are for anybody who's in the program, not just California, not just residential. It's for anybody who's in the program, regardless of your licensure path or what state you're in.
Awesome. Thank you both for that. So the next question is, can you talk a little bit about how students find a site, how they're supported through the process of securing a site, and if that process looks different for maybe those that live in the Bay Area or in different states or in a different country?
Yeah, so the process is really the same. We have, once you are in the program, you actually have a PAU email address and then do a survey that we require you to do. Meg runs our Tavera system, which is our kind of all things practicum and internship related document system. And all of our sites that are pre-approved are listed in there. So you can come in and say, oh, I'm in Ohio. Do you have any sites? I'm in Florida. Do you have any sites? You can punch in your zip code and 30-mile radius and see what sites we have. Those are pre-approved sites. Those are the ones that are easier to get through the paperwork because we don't have to start again and get a contract with them. But you don't have to go to those sites. So if you already are familiar with sites in your own community that you might be wanting to work at, or you're in a more remote area where we haven't had students, so we don't have sites approved, especially if you're international, and I don't know if anybody's international in this group, the sites are much fewer if you're, you know, overseas someplace. So we do have a list of pre-approved sites, but again, you can go off of that list as long as they meet the requirements. I will help you with that. We have an associate director of clinical training that can also help you. May can help you figure out where those things are. But students usually start from quarter 1, if not once they get admitted, already thinking about where they're going to do the placements. I assume all of you are already thinking about that, which is why you're here. So you can meet with us as the clinical training team. You can meet with your faculty advisors. Sometimes if we find out, oh, you're in an area where a certain faculty is, we might hook you up with them so you can talk to them about options. So there's a lot of different ways to kind of find your placement. We also host an annual practicum fair. It's online. We do that in January. We had between 40 and 50 sites at our last one. The neat thing with that is that there are sites, I think somebody's saying something about telehealth. There are sites that are telehealth sites that might be located in Southern California and you're in Northern California. You would be able to apply for some of those sites because you don't have to be in the area. It's saying if it's not our home state, can we do that? Meg's responding right there. If you are in California, you cannot work in another state. So you can't be in California and say, oh, there's a telehealth agency in Utah. I want to work for that. In a lot of other states, you can do that. Internationally, you can do that, but you can't work in California. So you can't necessarily be in China and take a California telehealth site. But we do have a handful of sites in Canada and around the US that will work with students in other states and other countries. So I think that's it. A lot more sites. If you're in the Bay Area, a lot of sites are in the Bay Area because that's where we have a ground presence. If you're going to look someplace like Los Angeles, we have quite a few sites there. If you're looking in Eureka, California, not going to find much up there. So, yeah.
Yeah, and I'd say the only thing I'd add, just to continue on to Caitlin's question, is just like you said, Dr. Herwick, it kind of depends on what state you're in. You can't go California to another state. But there are also some states that we just can't authorize students to work in. So like people oftentimes want to do Washington to Oregon. You can't do that. So I recommend just reaching out if you're not in California, just to double check on that and to see what your limitations may be. And the other thing I wanted to mention is we do have a practicum there every January. So that's a good opportunity to get an idea of the sites that we have. Like Dr. Herwig mentioned, most of our sites are in the Bay Area because that's local to us, but there are sites all over the US, and you're always welcome to propose your own site. And as long as it meets our requirements, should be no problem. So don't let that deter you if there aren't many sites that we already have a contract with, because you can always suggest one.
Great, thank you so much. The next question is actually one that I get a lot when I speak to prospective students, and that is, can I use my current workplace as my practicum and internship site? So for more context, some applicants will already work in a place that has some sort of therapy or mental health component, that wonder, if I work under a therapist currently, can I just use my job as my practicum and internship experience?
Yeah. So you can use your current employer if they meet our requirements. We are not just going to say yes, we have to actually go through the vetting process and a contract. You can use your current employer. For most cases, I will say you can't use your current position. The reason for that is all of you are working in a position that doesn't require you to be a master's level clinician. So we can't just say, oh, well, it doesn't need to be a master's level clinician right now, but a year from now, oh yes, you do the same things as a master's level clinician. So those aren't equitable positions. But if you are a case manager right now, or I don't know, like I worked at the School for the Deaf for a couple of years. If you were like working in the residential facility, great. And then maybe you go into the counseling center for your practicum. You can certainly do that. Some employers are wonderful and they'll switch you into a real clinical position where you get paid and benefits for doing your full-time job as a clinician. Others say you have to work your 40-hour-a-week job and then you can go over there 10 or 20 additional hours. Some say we'll give you a release time so you could do that 20 hours and be here 20 hours. If you're in a position at an agency now that you think has positions for you, I do encourage you to start having that conversation now to see if it's something that will happen, that will allow it to happen. Another thing that goes along with that, and I actually got 2 emails this week on it. Can I get paid for my internship? Yes, most definitely. I will tell you, most sites don't pay you. So you need to keep that in mind. If somebody wants to offer you pay, I'm all for it. If we could get you all paid positions, that's what we want. So certainly if your employer is giving you a second position and they want to pay you, we want that. Yeah. I know we skipped that question above it. Are we going back to that, Tanya? Only because I want to make sure we cover that. Okay. I didn't know if you thought I covered it already.
Yes, I thought you covered it. You can reiterate anything or add anything you want.
A question that I thought I was going to answer was how many hours count towards your license. So again, that's an MFT California specific thing. If you're a PCC in California, student hours don't go towards your license. In most states, student hours don't go towards your license. I believe in the state of Washington, you can earn up to 500 hours as a student, direct contact hours. So if you did 500 therapy hours with clients, that can go towards your license. We require 280. So anybody in the state of Washington, if you're in the state of Washington, you'll have at least 280 hours that will go towards your Washington license. In California, on the MFT track, all of the hours that you do, with some rules, your direct contact and indirect contact at your agency goes to your MFT license. What doesn't go towards your license is your class time. California, no license allows you to use that for your license. So the neat thing to keep in mind, I don't know if anybody's thinking of the MFT license, California allows you to count up to 1,300 hours while you're a student. So just because you only have to do 700 hours doesn't mean you have to stop there. We have quite a number of students that do 900, 1,000, 1,300 hours. What that means is post-degree, you're almost halfway done with your hours. That's kind of cool. So I just wanted to make sure I got to cover that because I think that's important when you're coming into the program and then choosing if you're going to do the MFT track or the CMHC track.
Exactly. Thank you so much, Dr. Herwick, for that. Yeah, and I just wanted to add one more question before we get into the student panel questions, which is another question I get a lot, and that is, are we required to take a full class load on top of our practicum and internship hours,
Yeah.
or not?
Yeah, so you do have to be a full-time student if you are getting financial aid. And I'm not going to go into that because I'm not the financial aid person, and I'm going to tell you to talk with that team about how that looks. But there's many students who don't take a full course load would look like you'd have at least 2 classes on top of practicum or internship. Practicum and internship is a real class. So you come to class every week, you have presentations, not big research papers, but you have some assignments, you have paperwork due, there's stuff to do in every class. And then you have classes 2 other nights a week. And then you're in your placement and you might have a full-time job and you might have children or parents or a life outside of school. So it gets pretty crazy. Other students choose to just kind of hold back a little bit. They work with their advisor to revise their degree plan a little bit. And they say, we're going to wait toward the end of our program so that we don't have all this coursework to do. And we want to just focus on practicum. So you can kind of, you'll have a degree plan, and then you can meet with your advisor if there's something that works out better for you. And I see a lot of questions. I'm going to assume that, Tanya, you're going to let us know if we're going to cover any of those questions. So
Yes, I will come back to those during the Q&A, but again, you guys can voice them during the Q&A. Also, Dr. Herwick, I don't know if you wanted to speak to the practicum and internship class component. Is that still a part of the program that maybe you can give us a better idea of what that looks like? Yeah.
So practicum and internship are always offered on Tuesday night. So just know when you get there, your Tuesday night class will be practicum and or internship. You, for the most part, can plan on at least 3 straight quarters. It is possible some students take a quarter and then maybe step away because life happens or the placement didn't work out, whatever the reason is. But for the most part, you come in fall, you take practicum, internship comes in winter, spring becomes internship 2. Some students stay on for a 4th quarter. If you're on the MFT track, you'd probably stay in internship until you're done with your full degree so that you can keep earning hours. It's a 2-hour class every week. Like I said, you have presentations, you have one bigger paper, a couple of littler assignments, you have logs that are due. Really, that class is kind of like an extension of the supervision you're getting at your agency. So you get a lot, especially in California, you get a lot of supervision at your agency. Other states, maybe not so much. And then you get additional supervision with a faculty supervisor and kind of your peer support, your cohort that's going through it with you. Yeah.
Great, thank you so much. I think that about does it for our preset questions for our clinical team. So I'll go ahead and move on to our questions for our student panelists. Okay, firstly, can you both walk us through what you do at your respective sites? So maybe the populations of clients that you serve, as well as just the kind of work that you do on an everyday basis.
Yeah, so my site is called Lifestance Health. It's actually it's kind of all over the country, which is kind of cool. And I am pretty independent there, I would say. I have been meeting individually with my clients since the beginning. I kind of got to choose the demographic that I want to work with, specifically the age range. So I personally am trying to focus on younger kiddos and adolescents into early adulthood is kind of my focus. And I do the intake with each of my clients. I do the treatment plan for them. I diagnose them with the support of my supervisor. I am at a site that requires us to diagnose after the intake. So that's been kind of an interesting process to go through, and it's taught me a lot about all the different disorders and just kind of navigating that. So that's, yeah, I think that answers the question.
And I am so sorry if there's too much noise in the background. Your work is happening apparently right now. So I am at the Wilson Center and might be familiar to some of you all who are local to the Bay Area. So the way Bill Wilson Center works is that it's a community-based mental health agency, and they run a bunch of different programs. So during the kind of after accepting the position at Wilson, they make kind of lists among their programs in priority where you want to do the internship. And then they try to match the interns to at least get some of what they want. So the way it works for me is I have my caseload at a high school where I do school-based counseling. Then I have half my hours at their clinic. So at the clinic, it's literally kind of who walks through the door. So the youngest client I have there is 7, and the oldest one is 75. And I kind of went into it not necessarily knowing exactly who I wanted to serve. So this has been a great opportunity for me to be exposed to a lot of different clients. But a site like mine, they also offer grief groups. They do child abuse treatment programs. So it's some community-based mental health programs offer a lot of different options, and that could be interesting if you're not quite sure yet where you want to end up. I'm also on the MFT track, so having kind of the opportunity to work with kids and families and couples were important to me, and that was kind of what my site was able to offer as well. And I think I'll stop there for now.
Perfect. Thank you both. Can you also share how frequently you work at your sites?
Yeah, I in during the practicum phase, kind of like Dr. Herwick was saying, it's a bit it's kind of like the hand holding phase where you're going a little bit slower, and you don't have a ton of clients yet. So I kind of started off just going in 10 hours per week, twice a week, which was nice. And now I'm currently coming in 3 days per week and anywhere between 15 and 20 hours. Though I will say, at least with how my site works, we have an intake team, so it takes some time to get intakes and new clients on your schedule. So I've kind of had this window of time where I've been waiting to get clients. So I'll probably have to ramp up the amount of time that I'm there just to kind of compensate for not having as many clients at the beginning of the internship phase. So I would say I'll probably head towards maybe around 25-ish hours to be able to get the rest of my internship hours.
So yes, I am at my site on 2 work days a week in the afternoons and evenings, and I have 1 school placement day. I will say that this could be something to think about when thinking about practicum sites, is what kind of flexibility they have in their hours. I know my site, because it's community-based mental health, a lot of the hours are kind of when other people are not working. So like evenings and weekends, which is great if you have to have another job. So it's just kind of that might be something you want to look into. There's another thing I want to share too. One of the mathematical pieces of internship is the hours. And I will say that for me, I did not anticipate how useful it would be to be within like reasonable driving distance from your site. Because there's like reschedules, and maybe some clients need to be seen at other times. So it's just a thing that I didn't know that I would benefit from, but I'm definitely benefiting from. So right now I kind of see clients whenever they need to be seen, it feels like, but within reason, of course.
Perfect. Thank you so much. Also, do you plan to have the same site for your practicum or your internship experience, or did you have multiple sites, or will you have multiple sites?
For me personally, I have stayed at the same site for practicum and internship, And I've just had a really awesome experience, thankfully, with my placement, my supervisor, and the support that I'm receiving. Though I have heard of peers maybe adding an additional site if they're not getting enough hours. And there is an opportunity to change your site too if it's not working out for you. I know that PAU is really good about kind of checking in with you to make sure that your site is a good match for you, and giving you that support if you do need to switch it.
So I am staying on to my my sites, and because of the different programs Bill Wilson specifically offers, I know we're quite a few interns have kind of switched between the programs within the sites, which has been kind of nice to get different exposures, but then only needing to learn like the systems and all the paperwork for once. And I'm actually at a site where I could potentially stay on even after graduation, and to me that's a perk of at least knowing that I potentially could if I wanted to. And I'm not looking into taking on another site. It's plenty with one site for me.
Awesome. Thank you so much. I did see a question in the chat that I thought could be interesting for you guys to answer as well, which is, did you choose your site location based on your passion for either modality or population, or was it based on availability?
For me, because I'm out of state, I kind of just tapped into my network that I have in Ohio to get my site. And also something I did like about it was that there was an opportunity to meet with different demographics, populations of clients as well, so that I could explore different ages and stages if I wanted to.
Sorry, it cut out a little bit. Could you just repeat the question?
Yeah, sure. The question is basically, how did you choose your site? Was it based off your passion for either the modality or the population you were working with, or was it more based on availability?
So for me, it was very kind of agency specific because I had worked with Bill Wilson's in some other capacities before joining PAU. However, in the interview process, I do think there was some intentionality around um, the because they run so many different programs. I wanted to make sure that there were ways to kind of fit into that. And then there's also who are the supervisors and kind of the work hours. So there's a lot of like practical things that I think we can be quite intentional about. For me, it was important to end up at an agency where I had some flexibility in finding out what my preferred modality would be, because I hadn't figured out that yet. So with the right supervisor, which I love my supervisor, there's also an opportunity to kind of grow your theories and not just your skills. And that was important to me to be at a site who had that flexibility.
Perfect, thank you. I do see a lot of questions in the chat. I also see Dr. Herwick and Meg, you guys are answering. You're doing a great job of answering a lot of them. I did see one reoccurring question, which is, can we see the list of sites that are available or are pre-approved? I don't know if either of you want to just acknowledge that question now, just in case
Yeah.
anyone didn't see the chat.
I think I did respond there, but if there's a ton of messages, so you might not find it. We have literally hundreds of sites, so we don't have them on like a Word document to send them out. They're on our online data system. So once you are a student and you have your student account and you have access to our Tavera, then you can log in there. I don't know who that was. I think it said Max, but I only maybe see the first few letters. I don't know. Asked, I'm in LA, do you have sites in the area? And I just posted a few of those sites just so you know that there are some there. Not that I want 70 of you to reach out and say, hey, send me a list of local sites, but if it's, really, really important and you need to know that there are sites in your area, we can talk about that. Somebody asked, what does that look like if you're an international student? Depending on where you are, we have sites approved in other countries, obviously not in every country, but we've had students in other countries and we've approved sites in other countries. the interesting thing to keep in mind, and I don't know who's international in this group, but most countries do not have licensing laws, which makes it pretty easy for you when you're trying, no, makes it, I'm not going to say it's easy. That's not true. Makes it a little bit more flexible for you when you're trying to find a placement. Like in California, you are not allowed to work in a private practice. In most states, you are allowed to work in private practice. In other countries, they don't care if you work in private practice, if you work on the streets, if you work in a homeless shelter, if you work, they don't care where you work. So all we have to do is make sure that you can meet the KCREP requirements. There's no jurisdictional requirements that complicate things. If you are international, because there are no laws like that, you can work at a site remotely in the United States if that site and that site state allows for you to do that. And I think I mentioned earlier, we do have a handful of sites that do allow that. I will say for international students, what I have learned is the norm is that your supervisors in your country will charge you for supervision because for the most part, you're not working for a nonprofit agency like most everyone in California, where you don't usually pay for supervision. It's something to think about. Do I want to pay for supervision? And if you are an international student who finds a placement in Canada or the US, it will likely be an agency that also requires you to pay for supervision. The reason for that is they have to pay a supervisor to supervise you, and they have to pay a supervisor to supervise you alone or with only one other person, versus if you were here in California and we saw you in group supervision, I could see 8 of you at one time. It doesn't cost the agency a whole lot of money, but to provide individual supervision is pricey. So if you're international, just keep that in mind.
Something I want to mention too is the application process for a site is not on Tavera. You can find sites to apply to, but you're not going to be applying to sites via Tavera. You'll do that on your own, following whatever the site wants you to do. And then Tavera is used so that we can get an agreement between the site and the school. So it's 2 separate things. And like Dr. Herwick said, we use Tavera to house all the sites, and we're not trying to gatekeep the list of sites from you, but it's something that's ever changing, and using this system helps us make sure that we have the correct information, we have the correct approved sites. Sometimes we have to place sites on hold. So it's really just an organizational thing for us. And as Dr. Herwick said, it'd be a little difficult if everybody's reaching out asking for a list of sites, but you can always reach out and we'll be happy to provide you information. And you also get access to Tavera during your first quarter in the program.
Perfect. Thank you both. That pretty much wraps up all of the preset questions that I had. So if anybody else wants to shout out questions, or you want to drop some in the chat, I was keeping track of some questions in the chat, but Meg and Dr. Herwick, you guys have pretty much answered most of those. So if anybody else has some, feel free to drop them there as well, or unmute yourself. Carla said in the chat, does getting the dual MFT LPCC allow for more flexibility if you're moving from state to state? I am in Nevada, but I will move to California during the program.
Most definitely. So I have been an MFT since, I don't know, 1998 or 1999, I think. We did not have PCCs in California. I had no clue what a PCC was because nobody talked about them in California. I certainly did not know what KCREP was. In 2010, so how many years later is that? 12 years later, California decided we would start to recognize PCCs. We got the licensure process going. We decided what it would look like for, a PCC in Florida to come to California. At that point, they offered those of us that had been licensed a certain number of years to be grandfathered in. We had to show that we met the other requirements, and we had to take an exam. We didn't have to get 3,000 hours again. And I debated it. I thought, why am I going to do it? I mean, I'm not planning on leaving California. I'm an MFT. I had my doctorate. I could do anything I wanted to do within the state. I literally, on the last day that application was due, January 30th or December 31st, I walked it into the post office so it would be postmarked on that day because I thought, oh, I better get my application in. No clue why, but I got both licenses. It's opened a lot of doors in the state because I have both specialties, but it also, again, I didn't know in 2010, 2012 that I was going to move out of the state. I came to Connecticut over the summer and I could get licensed as an MFT, but the license is a lot more complicated. The application is a lot more complicated, and I'd have to take an exam again. I don't want to take an exam again. I've done enough licensing exams. The PCC license, I fill out my application and I pay my fees and they verify that everything is accurate and I get my license. So much easier if you are dually licensed. I will say that in California, the MFT is still more highly recognized and more highly sought after, not because it's better, but because there are still people that were in business before 2012 that have no idea what PCCs do. And there are still agencies that haven't updated their MOUs because they haven't had to, because they could work with psychologists and social workers and MFTs. They haven't needed to look for PCCs. So they haven't taken the time and money to update that. If you are in any other state, or if you're a California clinician moving to another state, MFTs are not that well respected in other states. California has more than 70% of the nation's MFTs. So we're very popular in California. If you go to some other states, they might recognize the license, but they'll tell you you can't work independently. Many states don't allow MFTs to diagnose, which is the craziest thing to me because I've diagnosed since I was a student intern. So definitely more doors are open to you if you have dual licensure, if you're going to leave California. And I think somebody asked the question here, it's no more difficult. I didn't read your response, Meg, but I saw you did respond. It's no more difficult really to get the second license. You're going to take a couple of extra exams, but you're not doing 3,000 hours for the MFT and 3,000 hours for the PCC. So, yeah.
In my opinion, if you're considering doing both, just do both. Everything you do for the MFT will cover you for the LPCC. So just like Dr. Herwick said, it's not really any extra aside from the exams, but the hour requirements overlap, and it also overlaps what we require for graduation. So I wouldn't say it's really too much extra work. It just broadens your scope a little bit. Yeah, and I agree with what Dr. Herwick said about marketability. Really, I don't hear much about that except for international students. I know that having that credential can be more appealing.
Perfect. We also got a question from Jane. She says, do you have to get the LPCC licensure within a certain time period after graduating?
So good, because I wanted to say this instead of type it out. So with both licenses, you have 6 years to earn your hours. That doesn't mean you have to graduate and do them all within 6 years. You can graduate and go, I'm going to wait 10 years because I'm going to start a family. I'm going to go travel the world. I'm going to go to law school, whatever you want to do. But when you start your post-degree hours, you have 6 years to get them all done. There's a couple things to keep in mind, though. If you start your hours and then you don't finish them in 6 hours or 6 years, you've lost whatever is older than 6 years. So you could keep going, you just lose those earlier hours. The other thing is, no matter what, even when you graduate, you will meet the requirements that the state board has set for you as of then. The state board can change licensing laws. So the longer you wait, the more likely it is they're going to add something to your license. When I graduated, we didn't have any classes that covered anything about domestic violence. That was a course that I had to show that I took post-degree before my license. I think the other one was HIV and AIDS. I'm dating myself by saying how long ago I was in my program, but that wasn't in my program. So we had to have a class on that. It's usually not a full graduate level course. It's usually a 3 or 8 hour workshop. So the longer you wait, that will happen. But once you start your hours, I mean, all of your hours have to be done within 6 years. If you graduate and you wait past 6 years and you've earned 1,300 hours as a student, you don't keep all 1,300 hours. You can't count more than 500 hours as a student if you wait more than 6 years. Does that make sense? hopefully. And I will just tell you, if you're in California, it is way confusing and it's way convoluted. And we expect you to be a math major as an undergrad to figure out what the BBS really wants you to do when you're counting hours. Meg and I and everybody else will help you figure it out. Just know if you're feeling like, oh my God, this is too much and I don't know what I'm getting into. That's normal. We'll help you.
Speaking of confusion around hours, I think a few people are a bit confused about how the post-grad hours kind of work if you're looking at dual licensure, since it's possible to transfer over 1,300 to the MFT, but not for the LPCC. So how would that work if they want dual licensure?
So the neat thing is, and I think somebody said up there, somebody was asking about how do we get different experience so that we have experience with children and families and couples and all of this. You are not required as a student to have any specific experience. In a K-CREP accredited program, you are required to have some group counseling experience, but we don't care if it's children, families, adults, it doesn't matter. You could do everything in groups and never see one child or one individual. That's okay also. As an MFT, somewhere along the line, as a student or post-degree, you do need 500 hours working with children, couples, or families. So that is the one required. That's what makes you a specialist as an MFT, because PCCs can work with children, couples, and families. They just don't have that expertise built into their license. So if that's your goal and you want that expertise, you want the MFT. Your hours as a student go towards your MFT license. If you graduate and you've done 600 out of your hours count towards your MFT license, let's say, because the other 100 we'll say was class time. So you have 600 hours going towards your MFT license. What that means is you need 2,400 more hours as an MFT. You need 3,000 more hours for your PCC. So you register with the board, you register as an associate MFT and an associate PCC. You do one set of hours. You don't have to go over here and work as an MFT and over here and work as a PCC. You do one set of hours. You log them on 2 different logs. In 2,400 hours, this log is going to be done. You're going to have all your hours, and you're going to still need 600 more for this one. You're going to apply for licensing for your MFT. You're going to take your exam. You're going to pay your fees. You're going to pass your exam the first time. While you're doing that, because you're not licensed, you still have to work under supervision also, which is great because you're getting supervision here. So of course you're in supervision. And while you're on this path of taking the licensing exam, paying fees, you are finishing up your 600 hours. So now you're done with your MFT, you're licensed, yay. And you can go ahead and apply for your PCC license, take that exam, pay those fees, and now you have dual licensure.
Awesome. And then another question is, how common are remote internship/practicum sites?
They are becoming more common, and they're not very common. So 2020, when COVID hit, all of us went remote, right? Whether we wanted to or not, everything shut down and we went remote. 2021, a lot of things stayed that way. By 2022, agencies were really trying to determine what worked for their employees and for their clients. So some agencies gave up telehealth altogether. Some agencies loved not having the overhead of an office building to maintain, and they stayed with telehealth. And many do a little hybrid. So we do have some agencies that will require you to come in 1 day a week and then maybe let you do 2 days a week by telehealth. We have, Meg, how many, like 3 or 4 sites that are 100% telehealth in California right now. So hearing that, if all of you are interested in that, you could imagine it's going to be highly competitive. And keep in mind how many other counseling programs are in California, and they're all looking for that placement. So they are pretty competitive. Our e-clinic, the university's e-clinic, is totally, obviously, telehealth. That's why it's the E. And our students, our counseling students, can work there. Not every student, but students do apply to work there as an option. If you are in other states, you might have a little bit more flexibility with telehealth because you often could work in another state that has a telehealth option outside of your state.
Awesome. And we do have a question for our student panelists. It says, can you speak to how you vetted practicum sites and supervisors to ensure that you got the support and the alignment that you were looking for? And also, does Tavera have reviews from past interns?
I said a little bit of this in the chat, I think, but I thankfully when I was doing my interviews for sites, I did a few of them, and they had me interview with the person who would be my supervisor. So I was kind of able to get a feel for them just as a person. And then I definitely had some questions of my own. I don't remember exactly the things that I was asking. My priority was making sure that the site kind of would be able to meet the needs of the hours requirements and PAU's requirements as well. And I was personally kind of looking for, flexibility, and wanted to make sure I was going to get the support that I needed. So I tried to ask questions that aligned with my values to make sure that we were kind of lining up. And it doesn't hurt to kind of network around a little bit. As I mentioned before, the site that I'm at currently, I found because of someone I knew already that I had previously worked with, was did her internship there and had a great experience. So I was even able to just kind of vet her a little bit about her own experience and maybe ask some of those more personal questions and specific questions that I might not have asked in the interview process. So connecting with someone that you may know in the community or know of, or getting on LinkedIn or something, it doesn't hurt to reach out to people who already work there too.
Yeah, so just adding on to what Jordan said, I mean, so even if I knew pretty much that I wanted to go to Bill Wilson, I thought it didn't hurt to just interview with a few different places and just get a feel of what's out there. And I think, especially the supervision part, it could be interesting just to ask how they do supervision, especially the direct observation piece. So at my site, we can't record any audio or video, but we have like a mirror room. So like you have my supervisor stands on one side of the mirror and can watch me do my skills practice and give feedback. Some places will allow recordings. Some places do shadowing before you get to see your own clients. So even if you don't have a preference, these could be interesting questions to ask, so you know what supervision would look like for you. For me, when I had kind of decided on Bill Wilson, they had an open house, so we got to meet a lot of the people, not necessarily know exactly who our supervisor would be assigned, like which one would we be assigned to. I will say that they also had a vested interest in finding out what the good matches were. So in my interview process, they would ask me about how I would like to be supervised, and like what kind of how I receive feedback and things like that. So I find that this is very much a mutual conversation from the site and from the students of finding a good match. But know that there's quite a few different ways to do supervision, especially like the live watching you do things. So some food for thought. But I don't necessarily know that we have access to reviews of sites, not that I know of at least, but maybe I missed something.
We, if you want to know about a site specifically, like let's say you're interested in Bill Wilson and you say, can you let me know what students have been at Bill Wilson? We won't tell you the students that have been there, but I will respond to you and I'll blind copy students or alumni who have been there. And I will say, I'm connecting you with some people. They could decide to respond to you or not, because I'm not going to tell you who they are and I don't need you to keep asking them. So Jen, if that happened, you would probably be on an email. And if you wanted to reach out to that student, you can do that yourself. And then that way you get to tell them the good, the bad, and the ugly. If we've had reason to be concerned about a site, or if we know great things about the site, we'll tell you. Often students just email us and say, hey, what can you tell me about Bill Wilson? Or, and I can tell you, well, this site, we've only had one student. They liked it, but that doesn't mean others have, so we can give you that sort of feedback, but it's helpful sometimes to actually talk to the students who have been there.
Awesome. I did see a question that was asking, what the typical time frame people finish their licensure hours in.
So I'm not going to say typical. You have 6 years. I took all 6 years, but I was doing a doc program at the same time as I was doing my internship. So I think it really depends on what your plan. I would say 3, if you're really trying to get it done, if you're doing dual licensure, I would say probably 3 years, because you're going to take a law and ethics exam. You're going to do all of your hours. You're going to study for your clinical exam. You're going to take 1 or 2 exams, depending on if you're doing 2 licenses. I know some of you are thinking, well, I'm going to work 40 hours a week. So doesn't that mean I'm counting 40 hours a week? Not necessarily. It depends how much supervision you have. You might work for an agency that has you working 40 hours a week, but that doesn't mean you are working every hour of your time. You know, when you're on lunch break, when you're just chatting with friends, and I was a county employee, I know there's a lot of downtime. You have no shows. You don't get a count when you have a no show. Just because you got paid that hour from your employer doesn't mean you get to count that hour. So even if you're working, like I was working 40 hours a week, and I was probably counting 24 hours a week. So you need to kind of plan on that. I saw a question, somebody said, can you make a living wage in the Bay Area? I don't know that you can make a living wage in the Bay Area if you're working outside of tech. So I don't know how you do that.
I wouldn't plan on being paid
yeah.
a living wage,
Okay.
just to be honest.
I would say that our sites who do pay are paying about $20 an hour. I don't think that's a living wage in most of California. We do have a few sites that pay 30, and I've heard that there's a site not in California that's paying almost $50 for a client hour. They don't pay you for your supervision or your documentation time, but they pay almost $50 an hour for a client hour. That's huge. I made $9.97 as an intern, so that is pretty amazing. But yeah, I wouldn't plan on just having an internship if your income needed to put a roof over your head.
I'm gonna cut you off real quick. I have to head out, everybody. Gotta get to my own practicum. It was great to see everybody. If you have any questions, feel free to reach out directly and I'll get back to you. Have a good
Thanks.
day, everyone.
Perfect. Meg is doing her doc practicum. So are we able to sort for paid sites? No, I don't believe so, because they are available when they become available. So they might be available this year and not available next year. If they let us know they're paid, I send out emails. You'll get emails once you're in the program. You will get all sorts of emails from me, even if they don't really apply to you right now. I'll be saying, if you're looking for a placement, this place has openings right now. Here's a paid internship opportunity. You'll find out about like some grants and some stipend opportunities that you could apply for. So yeah.
Perfect. We're nearing the last few minutes of our webinar. So if you guys have any questions, I really recommend dropping them in the chat, or you can also unmute yourselves. Feel free to ask any questions to Dr. Herwick or to our MA students.
And just so you know, once you are in the program, we have all sorts of, we just do open office hours, Q&As, we do orientations a couple of times a year. I often come into your orientation class, which is a class you take in your first quarter, just to kind of give you some information. We go to residency, so you'll see us at residency. You'll probably get sick of hearing about practicum and internship, but we give you all sorts of information, and you have lots of opportunity to get the information from us. So. If you are doing distance learning or distance therapy. So I'm assuming most of you are going to be doing distance learning. Most of you will be in an online program. I'm assuming that most of you are not local to the campus. So we'll have class on Zoom. If you are doing telehealth, depending on the agency, like I said, some agencies will require you to come in 1 day a week, and they do supervision when you're in the office. Somebody asked, like, am I doing myself a disservice if I only do telehealth? My biased opinion is yes. I think you are missing out on something if you're not doing in-person services. That doesn't mean you have to do them. it is very likely that every licensing board will at some point over the next couple of years make it mandatory that you have at least some in-person services, because that's been a big debate since 2020. Are we really training you well if we're not making you actually see people face to face? So if you're doing 100% telehealth, Centio, the eClinic, those are two of our total telehealth sites in California, your supervision will be done like this also. It has to be done face-to-face video. It can't be by phone. It can't be by text, but you can do Zoom just like you would with your clients. That counts as your supervision. Do I know the dates of summer residency? I don't, but I do know it's posted on the web page and somebody can tell you.
I'm not sure if our upcoming dates are uploaded yet, but I do recommend just checking out that site for updates. I'll go ahead and find you the link to that. Thank you.
It's the first week of August. I know that only because I'm teaching a class and we needed to know that answer. I don't know the days. I'm assuming it's Monday through Friday, but.
Awesome. Thank you.
Perfect. Carla asked, can you speak to the acceptance rate for the online program? Is it the same instructors for the online and campus-based program? So I know that for the acceptance rate, it usually ranges at about 70%. It depends on the term. But for the instructors, I do believe it's the same. They just kind of switch off. Is that right, Dr. Herwig?
So I will say the residential faculty also teach online. The online faculty, for the most part, don't teach residentially because we're out of the state. We do come in for residencies, so you end up seeing most of us at residencies. But like I teach law and ethics, I'm never going to teach it on campus. I will just teach it online.
Awesome. So Har's asking if we still have slots open for the summer start. So we have a spring start and a fall start. We are still accepting applications for both, and so there are still slots available for both of those. I do recommend that if you're interested in the spring, you apply as soon as you can, since the deadline is in the next upcoming weeks. I think it's in 2 weeks, so definitely recommend doing that as soon as possible. If not, you have plenty of time for fall. Awesome. Any last minute questions? We're about to wrap up. I will go ahead and leave my email in the chat in case any of you guys have questions about admissions or the program. I'm happy to connect with you guys. Could you switch cohort? It's possible to switch cohorts. We don't usually recommend doing so, just because it can get a little complicated with the classes that you may need, since cohorts are taking different classes sometimes, but it's definitely possible. Someone's asking if they can get your email, Dr. Herwig. Is that okay? Is it possible to defer admission to the fall if you apply and get accepted to the spring cohort? Yes, you can defer up to 2 terms if you need to. If you're thinking about doing spring, how much time do you have to register for classes? So, like I said, deadline is in a few weeks. And once you get your admissions letter, which shouldn't be too long after that, you have, I think, until April 1st to register for classes. That's when the term starts. Awesome. Well, I'll go ahead and, oh, sorry, Dr. Herwig, did you want to add something?
I just want to say that for the most part, you're going to know what your degree plan looks like, and you'll know your next year of classes, what day they're offered, especially if you're on the MFT track, because there's no electives, you don't get to pick and choose classes. So it's not like going to state school where you're begging to get into your classes and you have to, yeah, it's not really set up that way.
Exactly. Yes, so I will be sending out a recording. Feel free to reach out to me directly if you don't receive it. But we'll also be posting this on YouTube. Thank you, Dr. Herwig. Yeah, 11 weeks usually. But yeah, awesome. Well, thank you guys all for joining us today. Thank you, Dr. Herwig, Meg, Jordan, and Jennifer for being our panelists. And thank you for all of you for joining us today. I hope you all have a wonderful weekend. I'll stick around if you guys have any last minute questions. Thank you, everyone.
Thanks, everyone. Good luck. Hope to see you soon.